Lunchtime for many in Mexico means this and this. Mexicans drink more fizzy beverages than almost anywhere else in the world. The country's also #1 in child obesity. All of that has led to rocketing diabetes in the nation's young, many of them in working class families like the ATRISCOs, who struggle to afford the healthy food and medical kit to control the illness. It took an urgent operation on 15-year-old Ricardo's pancreas to make him and his family realize he had to give up street food and eat healthier.
I cried a lot, and even now it's really difficult. It breaks my heart all the things he's gone through because of diabetes.
Diabetes figures in Mexico are rising, even as efforts are being made to tell people of the dangers. The situation's urgent. The disease is one of the top 2 killers in Mexico, and that's why the government and civil organizations have organized a fair for World Diabetes Day, complete with Mexican wrestlers to try and spread the message and publicize a bit more the impact of this illness. But educating the public hasn't been enough, so in 2013, authorities went further, levelling a 10% tax on fizzy drinks. Studies showed it reducing sales, but when Senator RIOS recently proposed doubling it, Congress refused to back him.
We're heading for a structural healthcare crisis for our population, so if this measure doesn't pass, the lawmakers that aren't supporting it should have to explain why.
In many marginalised communities, Coca-Cola is easier to get hold of than drinking water, and just as cheap. The government says it's installing more free water fountains in poor communities and trying to provide healthier school lunches. But for now, the onus is still on individual families to choose fruit and veg over tacos and quesadillas. And that's a hard sell here. John Holman, Jazeera, Mexico City.